Good morning. All right, so I'm going to do like a quick little mini class today on glute activation and why it's so important, and also why glute activation helps with knee pain, hip pain, low back pain. It also is very incorporated into pelvic floor work. So I'm going to try to not go too far off on a tangent because I could talk about this for a while. So what does glute activation mean? So first of all, I have a client who's doing the 21-day knee pain solution program. And he said, I didn't realize how important activating my glutes are. He said, I'm having a hard time with it, but I know after repetition and after a while, it'll all come together, right? And that is the truth. Like, I teach this privately and I teach this in Pellicore class, that your glute activation is so important. So that's how you could squeeze your butt. And you could test that. Like, you should be able to squeeze and activate your glutes. You could put your fingertips at the top of your butt, right below the hip bone, and try to squeeze and see if you feel a contraction. Now, you might not be able to do that at first, and that's okay. Perfectly normal, but could be the cause behind having back pain, having hip pain, having knee pain. Our glutes are our biggest muscle in our body. They're the strongest muscle, so they support all of our movement, from bending over to picking things up to walking. So you can imagine if you're walking and you can't get that glute to activate, if you're bending over all day and your back's doing the work, the back could get in pain. So we really try, a big part of my training is teaching people how to activate the glutes, incorporate the pelvic floor into that, and have whole body wellness and strength through mobility and strength. So again, the 21-day knee pain solution program is a mobility program and a strengthening program around the glutes and hips and back to mobilize, to be able to free up this area to relieve strain on the knees, and also to get you to activate the proper muscles, quads, hamstrings, glutes, that support the knee. You also have the lower leg in that too. And that could be broken down further, but the 21-day knee pain solution program is designed for you to do about 10 minutes a day of mobility. It's very digestible. Follow a video, have your own platform, and then you start to feel relief in the knees that you might have achy knees, painful knees. As long as you can get down and up off the ground, that program is good for you. All right, so let's break down glute activation. We did that a little bit, right? So you stand and listen, especially for my moms, it's so common after having kids that one side just kind of doesn't work anymore, or you can't feel it, you can't feel a muscle contraction. That's very common. After both of mine, I had right-sided, so I still have right-sided glute weakness. I can't get like a full contraction of the full glute, like especially more towards my tailbone, but I continue to work on it. And after having both of mine, I couldn't do. I couldn't balance on one leg. Still have a hard time on this side. I could not squeeze my butt on the right side. So specific types of training can help balance this out and also send those signals from your brain to your body to get the muscles working again. It just takes specificity. And also, if you're not breaking down what's single-sided exercise, you could continue to dominate deadlifts and squats with your strong leg, which could lead to more problems, more movement dysfunction, more aches and pains. And then when you go to do certain things, you're kind of wondering, why when I run, do I get a lot of knee pain? Well, it might be that you're not as strong on the right side as you are on the left side, but you're not training specifically enough to break that down and continue to build strength. You have to do that all the time. So it's not just you go through a phase of single-sided training and then you're done. Like, you are always breaking the body down segmentally and then putting it together to work functionally or wholly all together, right? So first, you probably do it seated or laying down. I can't move my camera because it might jack everything up. But if you lay down on your back and you go into pelvic tilts, you arch the back, and then as you come up and round, you should squeeze your glutes to get that pelvic tilt. I teach this in Pellicore class, and again, also with my private clients. I'm going to try to move this down, but my light's been acting funky. So when you're doing that pelvic tilt, what a lot of people do is they drive their feet into the ground to try to get the glutes to fire. So there's a lot of tricky ways that our body likes to pretend like it's doing the movement with a lot of compensation. And again, this is in the Knee Pain Solutions program too. It breaks it down, takes you through those workouts. So when you're pelvic tilting and you kind of drive the back down, which I don't recommend doing all your core exercises in a pelvic tilt. So in Pellicore, we focus on how to get the pelvic floor and deep core to engage while doing exercise. So this trains your body how to keep neutral pelvis, ribs down, and good posture. Otherwise, you're training in a pelvic tilt, which isn't very helpful in the long term. So when you do a pelvic tilt, you're squeezing your butt. Now, what you shouldn't be doing is pushing your feet so hard into the ground to try to squeeze your glute. If you cannot get a contraction on one side, again, that's normal, or both sides. So what we do is then we go into bridges where you exhale and you're trying to really feel that you're squeezing your butt to lift and not just pushing up through the low back. And so we're going to include the pelvic floor with that. What that would look like is inhale down, let the belly fill. As you exhale, you're drawing the marble up. So you're kind of stopping the flow of urine and drawing up as you're pushing through the feet. So what you want to focus on is like, am I dominating one side? Am I pushing more through the left than the right? And you may not pay attention to these things until somebody brings them up to you, which is again what I do with a lot of my clients. And then what you could do to test out how strong your glutes are, you could bring one foot up. Now, if you bring that foot up and you're struggling to keep the hip up on the right, or you don't really feel it in your butt, you could try to scoop the hips, tuck the tailbone a little bit, give yourself a little poke in the glutes to see if you could feel the contraction. Again, a lot of women who have had babies or any post-surgery, you may not feel one side contract, but if you touch the muscle as you're doing the exercise and you feel it harden up and contract, that's a good sign. Your sensation just might be off due to like any nerve damage or like just the body went back after pregnancy in a funky way. It is highly common and not talked about. I have a lot of women who deal with this. I deal with it myself, but it's not really addressed. So that's my own hypothesis. Most women do have decreased sensation. Can they contract? Possibly, but they might not feel it. And it's really important to highlight that and figure that out in your own body. And if you're a trainer, for sure, and your clients. So if you're going into the single leg lift and the hip starts to drop, you can't really hold up. That just shows you that individually, isolated, your glutes aren't that strong. And again, you want to be able to draw the pelvic floor up, keep the ribs down. Now, if you're in a bridge, but you're doing this, you're using a lot of accessory muscles pushing into the ground, low back to have your glute get the hips up. And we don't want to do that because we're really trying to isolate and strengthen the glutes. So that's a test for you to do. Now, if you're really like, I can't feel it at all, there's a better testing position. If you are on your stomach and you keep a straight leg, you got to make sure you keep that leg straight. And you squeeze to lift. Now again, you're contracting here. So you can put your fingers there, or if you have a client, you say, may I touch you? You put right on the top of the glute, squeeze to lift, and you should be able to feel that. You don't need to go high, because again, if you're going too high, you're just swinging the leg up, using momentum, and more so the low back. So then you test both sides. Can you feel it? Does one side feel stronger? So that's a place to start when you're thinking about glute activation. And if you are training or a trainer, and you don't address this within yourself or your clients, it is like a major thing that should be looked at. So you could also, because again, squats, deadlifts, your glutes should be doing the work. If you have problems with your back, and then I like to include the pelvic floor with that too. If you have problems with your low back with these lifts, it's typically a core weakness or a posture thing, or the glutes, because you're not being taught how to really like push through your feet, push the knees out gently, create this tension, squeeze your butt to lift, push through the floor, draw the core up. You don't want to be here, but this should be the prime mover. Again, so common with people that suffer from aches and pains, and that's kind of my sweet spot with clients. I love working with people that they're like, I could do a lot of things, but these certain movements hurt, and we break that down. And again, single-sided isn't addressed as much. Even doing a single leg stand, you could test slight bend in the knee, tall posture. Are you tucking your hips to balance? Are you wobbling? Are you able to squeeze your glute as you're standing? Because you want your butt to also help you balance. Now balance is very multifaceted. It could be the ankle, it could be the hip, it could be the knee, it could be vestibular. It could be a lot of different things. So, but to generally test the musculature of balance. Now this is my bad side, slight bend in the knee. Try to get that glute to squeeze, because that should be working. If you're not squeezing your glute, you're going out into your hip. You're not working your butt, your glute medius, or any part of the hip stabilizers. And that's like very, very important for daily function, mitigating daily pain, and be able to train properly and fully with your body. So again, like I teach pelvic core, and I teach my clients about the deep core as well. So even in a single leg stance, I'll have them do it without like any instruction, just to see what's going on. And then I'll say, now try to squeeze your glute by pushing your foot down into the floor, but keep a slight bend in the knee. Now draw the pelvic floor from your pubic bone all the way up to the top of your head. So it's like a Kegel, but you're drawing in and up, and you're not flaring your ribs. Balance, a lot of people get into the shoulders. So there's so many touch points when it comes to balancing. If you can't do this with properly engaging in proper form, how are you going to do a single leg deadlift that's without weight? A lot of people just go into weights, start loading before the movement's actually correct, because they might see it on Instagram. It might look cool. Somebody might have told them about this awesome exercise, which is, they're all great exercises, but if you're not doing them properly, they're just going to lead you to pain, possibly injury. And here's the cool thing. Once you learn how to move properly and engage your muscles how they should be engaged, you will get such a better workout with less exercises. Does that make sense? Like, if you truly are engaging the glute, the core, the back by stabilizing proper posture as you go into a single leg deadlift, now you're working all these points in one exercise. And some people are like, oh my God, I feel that so much more. That's the goal. You want to feel the exercise. You don't want to just go through it. If you go through it with no intention, now what are you mainly doing is using momentum and stretch. Using momentum, using stretch. Is the glute moving you up? Yeah, probably, if you're keeping a flat back. If not, your back's moving you. So there's just all these different components that you really should think about when you're breaking down exercise, especially as a trainer. It is so important to assess if the glutes are firing, especially for women who have had babies. Is one side firing more than the other? Most likely, yeah. I mean, I haven't really met a woman who's had a child, and when I assess the glutes, they usually say, I can't feel it. And I'm like, well, it's contracting, because I could tell, I could palpate, I could feel, and I could visually see. So you could see the contraction. But something about how I think, like, during pregnancy, everything, you know, the joints get a little lax. And then as they come back together, who knows what nerves are being impinged in that process. Also, a lot of people favor one side. So if they can't feel this side in their everyday life, and I know this because I've done it, I have right-sided pain for about 10 years now. I just said, okay, I won't stand on that side. And then what happens? We create a massive imbalance in the body that could present in pain in other areas. So if I have pain on my right side, and I say, yeah, but I have pain, but it's fine. And I'll say to my clients, okay, it's fine, but do you stand on that side? No, I just stand on my left. But now I'm having left hip pain, or now I'm having left knee pain, but it was my right side that started. And I'm just like, well, it's because over time, we just want to do what's easiest so we can move on with life, but it ends up having a residual effect. So if you have a client that has pain on one side, they will probably favor the other side, which could lead to injury on the other side. But also now they have a massive reduction in stability, in strength. You may even see, so I look at my clients to assess, and sometimes I could visually see which side is their dominant side. I have it too because, again, the right-sided pain. So even though I train and I'm really trying to get more in touch with this right side, I still favor my left. So I could see in my calf muscle, it's not as big. It's a little reduction of muscle in the right leg versus the left. So I know that's a lot of information. I'm going to kind of stop there because I could go on and on and on. But as a trainer, and if you are somebody who trains, you want to listen to this a couple times and figure out, like, am I evaluating these aspects in myself and my clients? Note with your client and note with yourself. What side is your weak side? Note, especially with the glute activation. Can I squeeze? Can you squeeze the right glute? If not, you want to try to do that sitting. If you can't do it sitting, you want to try that laying down. And then again, I did show 2 exercises to evaluate glute strength and how to engage the glute and isolate the glute on each side. So I hope that's helpful. Please leave in the comments if you guys have any questions. And again, I cover a lot of this privately with my clients and also in the Knee Pain Solutions program. It's a 21-day program that is linked in my bio. And it's a 21-day, 10 to 15 minute a day mobility program to help get the glutes firing, mobilize the back, hips, thoracic spine. Basically, it's like a nice little full body mobility program, and it helps to relieve knee pain is a residual effect, but there's many other benefits to it too, like it could help loosen up your back and your hips so you get a better feeling of wellness. And if you're training and you have these issues, ignoring them is not the way to go. You want to take the time to fix, to analyze, to get help if you need help in that process. And then you could create a better plan of action for longevity. You'll be able to develop more strength. You'll be able to do more types of exercise, and that will also filter into your everyday life. So if you have aches and pains every day, training in this type of way that's very specific can help daily pain. And also, so a lot of my clients will say, I think about that all the time now. So if you're going to pick something up, hip hinge, bend the knees, we're practicing the functional movement of what you should do. And is it going to be perfect? No. Every day you're not going to be like, chest up, hips back, bend the knees when you pick something up. But if you're training with those cues and that awareness, you become more aware of your body to maybe fix that a little bit. And then over time, you should fix that movement more. Another thing is, this is my last point, when you're washing your face, and again, this presents in a lot of back pain, hip pain, pelvic floor issues with women. Washing your face or the dishes, tails tucked, washing your face, everybody's rounded. I do this too. And then I'm like, oh my God, no wonder why my back hurts. So if you stagger your stance, push the hips back, and again, it's that hip hinge, which my clients are probably sick of me saying, but it's the hip hinge, then you can wash your face in proper alignment. And hey, you get a little workout too. You're saving your spine, your joints, your ligaments, your tendons from strain and pull by doing things the right way. And overall, it's about having a better lifestyle and mitigating pain on a daily basis. Thank you guys for coming. Please share this if you found it helpful, and let me know if you have any questions. Have a great day.